Good morning. Welcome back to Open Med School. Today I'll be discussing Internal Medicine Competency 8.4. Definition and classification of hypertension. Hypertension is a silent killer and is a global health problem. Basically, it is divided into, based on the etiology, into primary hypertension and secondary hypertension. And the severity, it is divided into stage 1 and stage 2. Today I'll be looking into the definition and classification of hypertension. The WHO definition is systolic BP more than 140 and diastolic BP more than 90. But the recent 2017 guidelines of ACC, that is American College of Cardiology and American Heart Association, the clinical definition of hypertension is systolic BP more than 130 and diastolic BP more than 80. So what is a normal BP? Normal blood pressure is considered as less than 120/80. So we will go into the severity of hypertension. So the blood pressure between 120, 129 systolic and diastolic less than 80 is called elevated blood pressure. Previously, there is a classification pre-hypertension, etc. that has been removed. Now the normal BP is less than 120 systolic, diastolic less than 80. Elevated blood pressure is below the hypertension, that is less than 130/80. Hope it is clear. Now comes the stage 1 hypertension. Stage 1 hypertension, systolic BP more than 130, less than 139, and diastolic BP 80 to 89. It is stage 1. Stage 2 hypertension is the BP systolic more than 140 and the diastolic more than 90. And there is hypertensive crisis, which are divided into urgencies and emergencies, where the BP is systolic usually more than 180 and diastolic more than 120. In the urgency, there is no target organ damage, but in emergency, there is target organ damage. That is a difference. Then there are special types of hypertension, depending upon the level. Isolated systolic hypertension. This is when the systolic BP more than 140 or equal to 140 and the diastolic BP is less than 90. It is common in the elderly. Then white coat hypertension. BP is seen only during the clinical examination. Outside, if you go for a ambulatory blood pressure monitoring, the BP is not elevated. Such cases are called white coat hypertension. Then another important condition is the masked hypertension. The clinical setting, the BP is normal, but outside the clinic, the BP is elevated. So this is how the classification depending upon the level of blood pressure. Now, depending upon the etiology, we basically divide the hypertension into primary or essential hypertension, which contributes 90 to 95% of the blood pressure. What is in the primary? There is no single etiology. It is multifactorial with the contribution by genetics, age, lifestyle, and environmental factors. And the second group is the secondary hypertension. Secondary hypertension means there is an identifiable etiology is there. Of which the most important is renal disease, either renal parenchymal disease or renovascular disease. Then endocrine causes like primary hyperaldosteronism, Cushing syndrome, thyroid disorders, all these can lead on to coarctation aorta. Is another example where there is a definite etiology is there, that is a secondary hypertension. So today we have discussed about the classification of hypertension depending upon the level of blood pressure, the special groups, and the primary and secondary. The next session we will be discussing on how to differentiate primary hypertension or essential hypertension from secondary hypertension. Stay tuned. Thank you.